Tell us a little bit about what you were feeling, what you were dealing with that brought you to see me.
Well, I had just anterior shoulder pain for literally years, at least 2 years. I work in the emergency department and was friends with an orthopedist, and he had been injecting me every few months over those 2 years, and I would get some relief, but it would always come back. So finally, we made the decision to go further and X-ray, and X-ray was negative. So he said, let's just get an MRI. We did, and I had three of the four rotator cuff muscles were torn. I had a slat tear. I had a biceps tendon tear with no trauma. Didn't know how I'd done it, but I did have this pain, and it was constant and just nagging and uncomfortable.
Okay, so what kind of things was difficult in life because of the pain?
Well, anything that required lifting up or pushing up or exercise, grabbing, even taking off my clothes, pulling a shirt over my head would hurt to the point that I would basically not use that arm. I would use a different way to take my shirt off. So it was just everything was affected. I'm an active person, live on a farm, work in an emergency department. I needed my shoulder and my arm, and it was just painful all the time.
Okay. When you got that diagnosis or you saw the image findings or the doctor, described what he saw, what went through your mind?
Well, I was shocked. I knew it hurt. I didn't realize it was as bad as what the MRI showed. And then the fact that my friend, the orthopedist, said, listen, this is above our heads here at our hospital. I'm going to refer you to a larger orthopedic facility. And he said, I've got a buddy there. They take care of Carolina Panthers and people like that. And he said, you're young. I want you to have, the best outcome, the best possibility of a good outcome. So whenever he kind of, pushed me down the road because of the severity of it, that was kind of a shocker. So yeah, I was sort of taken aback once we got the results.
Yeah, especially you being in the medical field and hearing that three out
Yeah,
of the tendons torn, plus slat, plus biceps.
yeah. And no
Yeah.
trauma. I couldn't figure it out.
Yeah, it doesn't make much sense. All right. So besides the injections, had you tried anything else to get relief? Okay.
No, other than
Yeah.
not doing anything and wasting
Yeah.
away.
Yeah. So this was back in the fall, and then you set up, or near the winter, I guess, you set up to get scheduled for rotator cuff repair, shoulder
hmm
surgery in
hmm
January.
hmm
Okay. And we have a mutual connection, and so they said, come see me.
Yep.
And you
And
were
I've got to tell that story to your credit. I was visiting my family in Memphis, and they had my family, several members of my family had great results with you. And my sister said, listen, it was Thanksgiving Day. And she said, Jason is a great guy. Let me call him, just see if he can see you. And you saw me at 3 o'clock in the afternoon on Thanksgiving Day, and I felt horrible for you doing that.
I didn't know that.
Uh,
Yeah.
yeah, and so I was impressed with that, if nothing else. And you said at that meeting, you said, I think I can help you. And
Yeah.
that was in November. I was scheduled to have surgery in January and was working to juggle my schedule to accommodate that. And then we just continued to meet after that. And
Yeah. So before you get into what happened as we continued to meet on that first visit, what do you remember about that?
not much. You basically assessed me, looked at
Yeah.
range of motion, looked at strength, looked at how much pain was elicited with movement. Uh, you just did a normal assessment of the situation. And you said, but from that assessment, you said, I think we can help you.
Yeah.
And so,
Yeah. how long into the process do you recall starting to see some positive effects?
I don't remember exactly how often we Zoomed, which is the way we did it. But I know our seems like our first real Zoom meeting was whenever I was out on a boat in the middle of a river bass fishing, and you just we started working on the thoracic spine stretching, and very soon after that, I started feeling relief and increased range of motion and less pain with certain movements.
Now let's grab
And
good.
it was very quickly within a few sessions at least. And I will say, this therapy and treatment is based on how often me as the patient can perform what you ask us to perform. So the more we do it, the better it is. So it's sort of in our hands. It's in some ways, a lot of ways.
Yeah, well, that's the beauty of this, that so many patients realize, oh, I can turn my symptoms down or off if I do my stuff here, and that's what we're hoping for, is to create that in our patients. So we saw that this was not so much about strengthening your shoulder tendons or stretching your shoulder.
No, no, I was stretching my thoracic spine. Yeah. And you sort of identified that early on, and even mentioned research and studies and books that you had read talking about this. And so that was sort of the direction we went in. And so it was all about stretching my T-spine.
Yep. So that was then. You had significant pain. It was affecting your ability to reach and pull and push and work with patients and work with the horses and sleep at night. And then you saw some positive effects. You were not working out exercise-wise, resistance training-wise back then. You were eager to do that, hoping to do that. You saw some changes through January. What did you do come January?
Well, I canceled surgery. I had met with another orthopedic surgeon, which was also a friend of mine, and we were getting ready to schedule my surgery the middle of January. I was going to be off the end of January, 1st of February, and go back to the ER to work the end of February. I was going to have 30 days in there to sort of get things sorted out after surgery and go back to work. And then the rest of my year was basically going to be spent in rehabbing my shoulder. So I wasn't looking forward to that. But when I came back, I canceled the surgery. So from November to January, I'd seen enough improvement that I was like, hey, if I can exist like this the rest of my life, I'm not going to do surgery. It was a marked improvement.
Yeah. And then how are you now, Todd?
I'm great. I had not lifted weights, which I had done pretty much all my life from high school till now. I had always been in the gym in some way. I'd ridden bikes. I was a college athlete. I'd always done stuff, and for the last 2 years, I hadn't done anything. So I'm now back in the gym. I'm doing bench presses, shoulder presses, curls, bicep presses, anything and everything I want. Squats. I can pretty much do anything and everything. I'm actually now doing pull-ups. I did install a pull-up bar in my home gym, and so I'm doing not wide, but I do inside my shoulder kind of pull-ups. I'm doing that, and all of this is pain-free. No pain after, no pain during. I've gained some muscle back. It's just overall physically and I guess you could say in some ways mentally, because I'm back in the gym, I'm feeling better. So it's been great. Yeah.
Yeah, fantastic. Good work. What's your takeaway from this whole experience?
My takeaway is, in general, people are trained to do what they do. So surgeons are trained to do surgery. And just because you have imaging that says this is what you have, surgeons see an image and say, well, the fix for that is surgery. It's not always the fix. So that's my takeaway is just because you have a tear, an injury, you do not have to necessarily have surgery. And I don't have any loss of tissue. I don't have any. I didn't have to go under the knife, so it's just been wonderful.
Yeah,
All kinds of advantages. The least, I mean, the my quality of life is the biggest thing, but even from an expense standpoint, I did not have to undergo the expense of surgery and rehab and, lost time at work if that's, could have been the case. So there's been all kinds of advantages.
Yeah. Well, you did the work. You followed through on your end. And I just know that you had a unique experience, and I appreciate you sharing your story.